Do you love tea and coffee, and the caffeine kick you get from them? If you do, you're not the only one. In the UK we drink over 165 million cups of tea and 70 million cups of coffee every day. We can also get this kick from other products. In the UK alone, on average, each person drinks over 210 litres of caffeinated soft drinks a year. That's just over 46 gallons if you still work things out like that. And energy drinks also give a huge caffeine kick to many people due to their high caffeine content. Caffeine is a drug that acts as a mild stimulant to your central nervous system. It is a drug found naturally in some plants but can also be manufactured artificially. Processed and dried, it is a white powder, but we don't normally see it like this. Once taken, 99% of the caffeine makes its way into your system very quickly. The effects can usually be felt within 15 minutes, and reach their strongest level in an hour or two. It will take around 10 hours for the caffeine to fully work its way out of your system. Caffeine affects several organs, but its main effect is on your brain. Caffeine is consumed through different foods and beverages, most commonly coffee, tea, soft drinks, energy drinks, and chocolate, but is also used in medicines, cold remedies, painkillers, skin treatments, and even weight loss supplements. Caffeine can also be found in the form of caffeinated sweets or mints, chewing gum, chewable tablets, and lozenges. The recommended daily allowance for caffeine intake is 300 to 400 mg per day. That's roughly 4 cups of coffee or 6 cups of tea. For both these recommendations, the cup sizes are quite small, a 237 ml cup. For other drinks it works out as 10 standard cans of cola, or 2 500 ml energy drinks a day. The 500 ml energy drink can is just over 1.5 times the size of a standard cola can, but at the same time it contains at least 5 times the amount of caffeine. Only 5 of the smaller 250 ml energy drink cans reaches the recommended maximum of 400 mg of caffeine per day. The 250 ml energy drink cans tend to contain around 80 mg of caffeine or more. And be aware that with energy drinks their caffeine content may be higher than you think, or more than we've suggested. Some doctors and scientists recommend a much lower caffeine intake, around 100 to 200 mg a day. But what is agreed is that more than 400 mg is far too much. It's also wise to check with your doctor to see if you have any conditions or take medicines that could react badly to caffeine. The way that caffeine affects a person depends upon their natural, genetic, caffeine sensitivity. The more sensitive you are to caffeine, the greater the effects. Those who are hypersensitive to caffeine can experience reactions after only small amounts, as little as 1 cup of coffee. These reactions could be experienced as heart palpitations, stomach upsets, anxiousness, headaches, shakes, and sleeplessness. Other people are allergic to caffeine, and this may result in rashes, itching, difficulty breathing, chest tightness, swollen face, swollen lips and tongue. Some people build up a tolerance to caffeine, which results in them needing to take larger amounts before feeling the effects. Tolerance leads to a dependence on caffeine, and this is where the greatest concerns for health are found. If you are tolerant, you will stop getting the benefits of caffeine but will have to take more and more, which speeds up its negative effects. People who drink above the recommended levels of caffeine usually develop tolerance. The rate at which this happens also depends on your own caffeine sensitivity. Some people develop tolerance with much less caffeine intake than others do. Tolerance can wear off between 20 hours to 4 days after stopping taking caffeine. However, when you have a tolerance to caffeine, you are most likely to experience withdrawal symptoms when you try to reduce or give up. These symptoms include headaches, apathy, weakness, irritability, tiredness, anxiety, tremors, insomnia, low mood, flu-like symptoms, muscle aches or stiffness, difficulty concentrating. Withdrawal symptoms usually pass within a week to 9 days. Good advice is that a gradual reduction of caffeine, rather than a sudden stop, will usually help you to reduce the symptoms of withdrawal. Doctors also warn that people with medical conditions such as those on the screen, would do best to seek medical advice about their intake of caffeine, and consider reducing their intake to as close to zero as possible. And if you're a singer, studies have shown that too much caffeine has a negative effect on the quality of your singing voice. So, how much caffeine is in everyday drinks? This is quite hard to say as there may be different amounts of caffeine within similar products. An example of this would be the coffee served in cafes, coffee houses, and chains. The figures we use are from coffee house chains that you'll be familiar with. But we've used our own company logos. Coffee houses may sell coffees with more caffeine in them than other coffee houses. The same goes for the different methods of preparing coffee. Some result in stronger coffees than others. The two most used types of bean in the coffee trade are Arabica and Robusta. One Arabica bean usually has around 6 mg of caffeine, while a single Robusta bean may contain around 10 mg. Generally, Robusta coffee beans have around 67% more caffeine than the Arabica variety. So, two coffees made in the exact same way, but one with Robusta beans and the other with Arabica beans, would have vastly different amounts of caffeine in them. You need to be careful about the sizes of cups or mugs in which the drinks are being sold. More coffee means more caffeine. And don't think the names they give cup sizes helps. For some, a medium is the same size as a small in another shop, and so on. And they can also make up their own names for sizes too, to make them sound good. Is it clear what their sizes are from names like these? This isn't just about coffee or coffee shops. Even different tea types have varying caffeine amounts. For a small, standard, 250 ml cup, these tea types typically have the following caffeine contents. Black tea, 60 to 90 mg. Oolong tea, 50 to 75 mg. Green tea, 35 to 70 mg. White tea, 30 to 55 mg. But just like coffee, the caffeine content also depends on preparation, brewing, and even the growing methods. We should be cautious about the amount of caffeine in all caffeinated drinks. And if you're buying any caffeinated products for home use, check the labels and packaging for caffeine content. Taking everything into consideration, here are the approximate caffeine amounts in some everyday drinks. A 237 ml cup of regular instant coffee has around 62 mg of caffeine per serving, while the same amount of everyday tea has over 42 mg of caffeine, and a similar serving of hot milk chocolate contains about 5 mg. In a standard 330 ml can, colas and similar soft drinks have around 30 to 40 mg of caffeine, while amazingly, some diet or sugar-free soft drinks have much more, up to 46 mg, while energy drinks range from 75 mg to a whopping 220 mg of caffeine per serving. And, remember that a cup is a cup, and not a mug, or one of the larger sizes that can be bought, such as 350 ml, 470 ml, 590 ml, and the massive 920 ml varieties. The measurements we have given are for the small, 237 ml cups only. In a Main Street coffee house chain, An average large-size latte will hold around 175 milligrams of caffeine. Drink another 2 of these and your daily intake is gone, and you are 125 milligrams over the limit. Drinking only 2 of these will keep you just inside your daily maximum. And, while we're at it, let's not forget about eating chocolate. In the UK, most standard-sized milk chocolate bars contain around 10 milligrams of caffeine, while dark chocolate has about 25 milligrams. And don't get caught out. The larger the chocolate bar, the higher the caffeine content, and the more cocoa in the chocolate, the higher the caffeine level. So, what does caffeine actually do to you? From an energy point of view, caffeine increases adrenaline levels, preparing your body to deal with a threat, and this results in you becoming more alert, your heart rate increasing, and more blood traveling to your muscles. That's what gives you that boost of energy you want, especially first thing in the morning. Your blood pressure rises, your pupils dilate, and the blood vessels on your skin tighten. The tightening of blood vessels is a natural response to reduce the flow of blood from any cuts you might receive if you have to fight or run away. It's well known that caffeine can give you a kick and help you to wake up. But this also has a downside. Caffeine wakes you up by blocking a chemical in your brain known as adenosine. This chemical tells you when to go to sleep, so, without it working properly, your sleep pattern is disturbed. Studies suggest that you should not consume any caffeine for at least 6 hours before going to bed to try and sleep. This will reduce the chance of a disturbed sleep pattern. Have a look at our video, Sleep. This shows how a disturbed sleep pattern can have a major effect upon your health and well-being. Too much caffeine may result in caffeine jitters, which are experienced as agitation and shakes, irritability, nervousness, fear, restlessness, and difficulty sleeping, tingling in limbs and around the mouth, tinnitus, which is a ringing in the ears, reduced control of fine motor movements, confusion, an increase in the need to urinate, an increase in the frequency of urination, heartburn, nausea, vomiting, diarrhea, chest pain, abdominal pain, abnormal heart rhythm, unstable blood pressure, seizures, especially for those who suffer from epilepsy, sensitivity to light, restless leg syndrome, a red or flushed face, rambling speech or thoughts, dry mouth, thirst, headaches including migraines. Studies have shown that taking 3 or more caffeinated drinks a day could cause migraines. Worsening of premenstrual symptoms. Too much caffeine, around 1,200 milligrams in a short period of time, can be poisonous. Death from this is rare, but can occur if the concentration of caffeine in the blood is greater than 100 milligrams per liter of blood. Some serious long-term problems can develop from, for example, regular abnormal heart rhythms, or unstable blood pressure. And, there are other longer-term concerns that could result. Too much caffeine during pregnancy may lead to miscarriages, stillbirths, low birth weight, or later life problems, according to some studies. Babies have also been observed showing caffeine withdrawal symptom for a few days after their birth. The NHS suggests that if you are pregnant, you should limit your caffeine intake to a maximum of 200 milligrams a day or much less if you can. 200 milligrams is around 3 small cups of instant coffee. Alternatively, 4 small cups of tea, or 5 normal-sized cans of cola. But if it's a diet or low-sugar cola, it should only be 4 cans. And don't even think about drinking those highly caffeinated energy drinks. Calcium is vital to the maintenance of our skeletal structure and bone strength. Caffeine, unfortunately, prevents calcium being absorbed by your bones and as such increases the risk of osteoporosis as you get older. This makes your bones weaker and more likely to fracture or break. Caffeine also increases the amount of calcium that is flushed out of your body in your urine. This adds to bone problems by reducing the amount of calcium available for your body to use. Good suggestions would be to add calcium to your diet, or to consider using supplements. But, as with all dietary changes or the decision on what foods or supplements you should take, consult your doctor and a nutritionist first. Some recent research suggests several possible positive effects of caffeine. For example, being helpful in the control and treatment of some cancers, Parkinson's disease, and even type 2 diabetes, but only when used in carefully controlled amounts. Unfortunately, other research shows harmful effects on some cancers, and creating complications for type 2 diabetes while reducing the effectiveness of drugs used to treat it. It's a bit confusing and uncertain, so it is as well to keep up to date with recommendations. We've looked at some aspects of energy drinks already, but although the problems associated with taking too much caffeine are much the same, growing concerns have been noted over the use of energy drinks due to their high caffeine content, and how many are being consumed in short periods of time. Drinking energy drinks results in a sudden high level of caffeine intake, which creates potential risks, as your body is not designed to deal with such large amounts of caffeine in a short time span. The potential risks include caffeine overdose resulting in palpitations, high blood pressure, nausea and vomiting, convulsions and, in some cases, even death. Developing type 2 diabetes. High consumption of caffeine reduces insulin sensitivity, meaning that you could become insulin resistant, leading to type 2 diabetes and all the added risks that it has to your health. Late miscarriages, low birth weight and stillbirths in pregnant women. Children and adolescents can develop neurological and cardiovascular system problems. Risky sensation-seeking behavior. Poor dental health. And also obesity. The mixing of energy drinks with alcohol can result in wide-awake drunks who have much reduced inhibitions and no tiredness to restrict them. This leads them to exhibit extremely risky behavior that may lead to injury, death, crime, and other consequences. Watch our video, Alcohol and You, to see some of the possible outcomes. We must be aware that not everything about caffeine is bad. Not even everything about drinking coffee or tea is bad either. Caffeine makes people more alert, you feel energized and your mood is lifted. Caffeine can help to reduce headaches, but only if taken in small amounts. Larger amounts appear to trigger headaches, anxiety, agitation, chest pain, and ringing in the ears. In controlled amounts, caffeine is used to assist the effectiveness of some medicines and treatments. In certain examples, pain relief is improved by up to 40% when caffeine is part of the treatment. Even though we want you to know about the effects of caffeine, we don't want you to think that drinking coffee or tea is all bad. There are benefits to both of these drinks, when taken within the recommended limits, due to other qualities they have, that can have a positive effect on you. Coffee also includes other substances called polyphenols which give you real benefits. Studies show that drinking the recommended allowance of coffee per day may reduce the risk of heart disease, dementia, and strokes. The best benefits come from drinking black coffee. Sugars and fats from milk can cause their own problems for your health and well-being. Teas have been linked to anti-inflammatory properties, cardiovascular support, and improved kidney function. Again, the best benefits come from unsweetened and non-milked tea and refer to tea being consumed within the guideline limits. So, after all of that, what can you do to reduce and control your caffeine intake? Here are our top tips and advice for you. Become informed and make smart choices by looking at labels, menus, and price lists, then choose wisely. Keep to the recommended daily intake as suggested, a maximum of 300 to 400 milligrams of caffeine per day and lower if you can. Reduce your intake of caffeine by taking smaller amounts, spoonfuls, cup sizes, lower strength caffeine products, chocolate bar sizes. It is usually better to reduce your intake of caffeine rather than stopping immediately. For coffee or tea, reduce your intake by the equivalent of half a cup per day until you get below the limit. Replace caffeinated drinks with alternatives such as water, fruit juice, or decaffeinated tea or coffee. Be aware that decaffeinated products still have some caffeine in them but at low levels. For example, a 237 milliliter cup of coffee will contain about 7 milligrams of caffeine, with tea at around 2 milligrams. Stop or severely limit the number of energy drinks you drink, as they can be high in caffeine and offer a high risk of negative effects. To help reduce disturbed sleep, do not consume any caffeine within 6 hours of bedtime. Be aware that you may experience some withdrawal symptoms such as headaches, irritability, tiredness, anxiety, tremors, and low mood, but these usually pass within a week to 9 days. Withdrawal tends to only last for a relatively short time, but that doesn't mean that it will be easy. However, you can take some simple steps to prepare and make it manageable. We've already mentioned the first thing to do. Reduce your intake of caffeine in stages rather than stopping immediately. Try reducing by half a cup of coffee or tea, or a can of caffeinated drink a day. Stay hydrated, and this will help to reduce symptoms such as drowsiness, lack of energy, and difficulty concentrating. Water is the best thing for this, but an unsweetened fruit juice works well. Be prepared to manage headaches that could be triggered. There are many ways to do this, but always check with your doctor if you are going to take medicines, painkillers, or natural therapies, or any items you choose to ingest or use on your skin. Here are some ideas to manage those withdrawal headaches. Lie down and rest with your eyes shut. Spend time in a dimly lit area or room. Wear tinted glasses or sunglasses, especially outdoors. Keep away from computer or mobile device screens. Put a heated pad or hot compress on your neck or back of your head. Place a cold pack or ice pack on your forehead. Massage your temples and neck. Apply peppermint oil to your temples. Drink peppermint tea. Put a few drops of essential oils of lavender or peppermint into a warm bath and relax in it. Use a diffuser or spray to add lavender or peppermint into the room where you are. Take a small amount of ginger. Ginger tea is a good way to do this. Use yoga, mindfulness, or body relaxation techniques. If headaches become difficult, you may need to use a painkiller, but you have to be prepared. Many painkillers contain caffeine. So, in advance, have some non-caffeinated painkillers ready for use. Your doctor could help you to identify the best ones for you. But don't feel bad if you have to take one or two with caffeine in them, just be aware and limit their use. If your withdrawal symptoms become unbearable, try eating something containing a low amount of caffeine, such as chocolate, or drink some decaffeinated tea or coffee, as they will still have caffeine in them, but at a low level. And remember, it is important to talk to your doctor or medical practice nurse to get advice that is tailored for you. They will also be able to give you additional advice on how to deal with any withdrawal symptoms. Caffeine has both good and bad effects. Keep to the guidelines and you can feel energized, happy, and able to face the day ahead. Go overboard and take too much caffeine, and the jitters will kick in. You might become cranky and irritable, and you could be setting yourself up with long-term health problems. Keep to the suggested limits and choose a healthy lifestyle, for example healthy eating, exercise, sensible sleeping habits, and create a healthy work-life balance to achieve the best for you. Whatever stage your caffeine journey is in now, make sure it goes the right way for you and your health. Working with any, or all of the Wellness Center's programs, will bring small changes that will make huge differences to your life. If you are worried, or concerned, and need a little help, then follow the Wellness Center link and contact us at hello@wellingtonwellness.co.uk. The center will help you to find lots more tips and advice, as well as external links to the NHS, and other agencies that can support your caffeine reduction journey.